This is my fibroid story.
This is my endo and fibroid story.
This is our fibroid story.
Endometriosis, PCOS, ovarian cysts, fibroids. What are they? Where did they come from? And why are they bothering us, especially Black women? I don't know. I'm not a medical professional. I'm just here to share my experience. So let me introduce myself first. I am Kisha, the Fierce brand creator of Fierce Unapologetically, where our goal is to inspire and uplift and encourage women to be their fiercest self, be unique, be different, be dope, and not apologize for it. I am also a travel planner. I have a event management company, and I'm just here today to, again, share my story about fibroids and all these things that affect Black women that for the most part I don't hear about in my community. And I have some very lovely women here that were so gracious enough to share their story with me and with you all as well. So I'm gonna have them introduce themselves, and then we can get into this conversation, which I hope helps somebody out there. So we'll start with you, Candace. Can you tell us your name, tell us a little bit about yourself, and if you can give us your initial diagnosis?
All right, everyone. Hi, my name is Candace. I am a registered nurse. So my initial diagnosis was fibroids and an enlarged uterus. And I received that. I kind of knew being a nurse, but nurses, we really just don't go and take care of ourselves because we're so busy taking care of everybody else. So when I actually decided that it was just too much, that's what it was.
Okay. Thank you, Candace, for being here. And can you, Lady in Pink, tell us your name, who you are, and your initial diagnosis or diagnosis?
Okay. So my name is Taffy Foster Tony. Full-time job, I am a lead case manager for the driver's license recovery program with Wisconsin Community Services. I was first diagnosed with endometriosis back in the 90s. During that time, a lot of people hadn't heard of endo at all, which endo for short, instead of saying endometriosis. Didn't know what it was, didn't know what was causing it. I just know I was having extreme pain. And it took a while for the diagnosis to finally get called endometriosis. And then from there, it was just trying different treatments. Okay. And then eventually I had to have surgery.
Okay, so again, I'm Kisha, and my diagnosis was fibroids. Now, we're going to talk about the symptoms. I had symptoms probably for actually a couple years before I got my official diagnosis, and, the process started from there. I remember having, so again, this is a women's conversation. So we're going to talk about gynecological things. We're going to talk about women's parts and all of that. So if you don't want to hear it, then bless your heart. So I remember having very heavy cycles, and it got heavier over time. I remember having a lot of pelvic pain, a lot of back pain, having frequent bathroom breaks, frequent urination, urinary urgency. So I had these symptoms for probably a while before I was like, okay, look, let me see what's going on. I am somebody that goes to to the doctor often, so I'm not one of those people that would say, something's wrong, I'll just wait. I was like, doc, I need to see you tomorrow. Something not right. So that was my initial symptoms. So can you tell me, Taffy, about your symptoms before you went into the doctor? Like, what caused you to say, hey, something's going on?
Okay. Not only have I experienced endometriosis, I also had fibroids as well. But first it was the endo. I did make it a point that I went and did my yearly Pap smear as scheduled. And like you had said I was having heavy menstrual cycles and then pain. And so my doctor set me down, okay, we're going to, try to, see what's going on. But eventually, I was diagnosed with endometriosis. And thank goodness my doctor, who knew about endo, but she knew a little about endo, and she actually referred me to a specialist.
Did you have more symptoms? Was it like a specific symptom that you were like, let me go and
The
figure
heavy,
this out?
the
It
heavy.
was just the
periods.
heavy. Okay.
The heavy periods.
Okay.
And so I was fortunate enough because, like other women, like they weren't referred to a specialist, and I learned this by joining a support group for women who were suffering from endometriosis. And the doctor here in Wisconsin is actually one of the leading doctors when it comes to endometriosis surgery. So I was very fortunate to have this doctor.
Okay. But don't tell us about the treatment yet, because we're going to get
Okay.
into that. I just want to talk about the symptoms, just in case there's somebody out here like, okay, well, I might have symptoms, because I know a lot of women, especially since I've had my diagnosis and treatment and everything, there's been like people I know that have said, I've always had some symptoms. I'm like, well, go to the doctor, and get those
Yeah.
checked out, because just because you have heavy menses or pain during your cycle doesn't necessarily mean it's normal. So tell me about the symptoms, Candace, that you had to make you say, let me look into this, especially with you being a registered nurse.
Okay, so I think I never really knew. I probably had fibroids for so long, and like probably from the very beginning, because I was a late bloomer. I did not get my cycle until I was like 16. I thought it would never come, and I was like, praise you, Jesus. But when it came, I was like, oh, me. But so I've always had, painful cycles, but over the years, it just got more and more painful. Like my teeth hurt, my hair follicles hurt, my toenails hurt, everything hurts. And then I started having like pregnancy symptoms. Like I was eating up where I was going. I was throwing up like all of the things. And like, I just felt so heavy. Like it feels like you're actually pregnant, like you're carrying a baby, like
Right.
so heavy. I can't hardly move. I'm waddling. So I'm like, okay, like now this is ridiculous, Candace. Like you have to go and do something. And then like you said, the frequent urinations, like changing, your feminine products like every hour on the hour, going through your clothing, absolute ridiculousness.
And you said, look, let me
I
go
said-
even though I'm a registered nurse and I can kind of diagnose, you said, let me go to the doctor and see.
Absolutely.
Okay. Yeah, I think before I actually went to the doctor, I did my own research. Now, besides those things that I mentioned I did, I also have a career that I have been in for a very, very long time. So working in the medical field. So I kind of was diagnosing myself. I didn't think it would be fibroids. I didn't think that was it. And I really wasn't sure for the most part. So when I went, after I did my little research, did you kind of like do your own research before going to the doctor?
I actually didn't
Okay.
do my own
You just
research.
like, I'm going to the doctor. And
Yes.
Okay.
Mm-hmm.
And you said you working
I
in that
just knew.
field. Yeah, you knew it was that. I kind of, before I went in, I did my little research, set my appointment, and went in. Went to my primary. She recommended a specialist. And I went to the specialist, and I wasn't feeling good about what she was telling me. She was very abrupt. She wasn't nice, let me tell it. And she was more so, let me go back a bit. Before I went to the specialist, when I went to my primary, she had me do an ultrasound. So I did the ultrasound. That's when they noticed. And then she sent me to the specialist. Now, when I went to the specialist, she just kind of reviewed the results and was just like, so you can do ablation, you can do this, or have a hysterectomy. What do you want? And I'm like, can you give me some more info? Can you give me? So I felt kind of taken aback. So when I went back home, I messaged my primary. I was like, I need to see someone else because this is not it. What was your experience, Taffy, once you actually got in there? Because you said with your physician, she recommended you to a specialist. So what happened when you got to the specialist?
You know what? Like you said, when I first met the specialist, I was kind of turned off because she was really like stern, didn't have a smile on her face. But then I had to get to know her. And what I liked about her, she was very informational. She knew her job. She was on point. She answered all my questions. She sat down with me and explained everything to me, right? She took the time to do that. So my feeling of her being like stern and to the point, all that went out the window.
Right.
When she just was on point with everything and made me feel comfortable and assured me that she was gonna take care of me, and she was gonna take care of my issue.
So with that, once you went to the specialist, and this is with your endometriosis diagnosis, did you get your fibroid diagnosis around the same time?
Well, no.
Okay.
No,
So-
and just to backtrack, I did try other remedies before I had my surgery, so I didn't go right into surgery.
Okay,
right?
that's fine. We're gonna talk about the surgery
Yeah.
part too. I just want to kind of take people through the kind of like the journey of, from the symptoms and the treatment and the decision and then all of that. So you went to the specialist, you felt better with her, but your fibroid diagnosis didn't come just
No.
yet, you said. Okay, so once you went to your physician, and what happened?
So my physician was kind of new to me. Like I went, with just annual checks, and I'm rather a healthy person. So when I went to and I told her, all of the things, and she's like, "Oh, you're 38 years old. Like, oh yeah, like we just gonna take it out." And I was like, "Excuse me." Like, first of all, ma'am, this is like my first time meeting you. You ain't gonna take nothing out. So, like, I was very turned off, like you guys was by her delivery, and like, just like, and me being a nurse, knowing that there were other options that she could possibly have offered me, or even went through, like, even though these options are out there, like the best option for you would be hysterectomy. Like, I just didn't like her delivery of it, so I sought out my own specialist, and I looked up someone that specialized in fibroids and someone who looked like me. I think that would be more in touch and be able to deliver it better for me. So once I met her, then I was like, okay.
And that's a good point, because you said you sought out somebody that looked like you. I think oftentimes we might feel, especially women of color, we feel better having physicians and things of that sort that kind of look like us, because we feel like they can understand us a little bit better. Mine's did not look like me. My primary, none of my physicians are African American, but the second specialist I saw, which she was, I think I had to, she wasn't even my OB at the time. Now she is, but she was like, I was like, this is heaven sent, because she's perfect. So she was caring. She was more so, these are your options, but let's talk about, what your future plans are, so we can see which option might be better for you now. So that was, like perfect. Even though she didn't look like me, she kind of understood me. And I decided, for the most part, even though she gave me the treatment options and I felt better about them, I just kind of put it in the back of my mind. And because if y'all know me, y'all know I'm just going to work and do what I need to do. I was like, we'll worry about that later. We'll worry about that later. And the later was about a year or two. Now, through that, it was some struggle. Me, I'm an event planner, so me doing events, bending over, doing all this stuff. Taffy was there a couple times. Once I finally told her, I'm like, that hurt it, me bending over, because my abdomen had got, now, I'm a little older, so I ain't as slim as I used to be. But even my abdomen had got a little thicker, and I just didn't understand why until I got my diagnosis, but it was getting bigger and bigger. And we'll talk about, the fibroids and the size and that later, but I just let it go to the point where I couldn't take it. Like, my back pain, how I slept was hurting. It was a lot. But I just pushed through it to the point where I couldn't take it. And then I finally said, okay, I'm ready to have the treatment option. So tell me, Taffy, once you got to the point where you decided to have, especially for endometriosis, and let's go back a little bit because we've been talking about fibroids and endometriosis, but we haven't told people. We're just assuming everybody knows what they are. So for those who may not know, we are not medical professionals. I'm not. She's not. She is. But do your own research before you take heed to everything that we say here. So fibroids are benign muscle masses that are in the uterus. They're like balls of masses. They're not cancerous if they're fibroids, right? What add in?
So a fibroid can also be in the uterine wall, outside of the uterine wall. So anything dealing with the uterus, like it can be in, and it's actually a tumor, but it's like a muscle mass, like a fibrous muscle mass.
And it's benign. It's not cancerous if it's a fibroid. So, and then for endometriosis, Taffy, tell us, briefly what that is.
So to simplify it, endo is you have your regular flow of your menstrual cycle. So when it comes to endo, that flow is not the regular flow of your menstrual cycle. And when that happens, it's flowing outside of where it should be flowing. And then when that occurs, then you start developing scar tissues. And so in that scar tissue is that the pain that you're feeling. And it can be like fibroids outside the uterus, around the uterus, around other parts of women. And the thing is, a lot of women don't know that or told if they have a hysterectomy, that's the cure. But that's not true.
Right. We'll
That is
get
not
into
true.
That, right. Anything you want to add about endometriosis or?
No, Taffy did a great job of explaining it. It's just like a thickening of that uterine wall, and when that flow does not flow the way that it's supposed to, and it causes like all of this scar tissue all on the inside.
And causes all that pain. Okay, so let's get into the treatment. So you decided after a while, how long was it after your diagnosis of endo, we'll just say for short, did you decide to get treatment?
I'm going to say it's probably about 6 months because I tried other things. They tried changing my different birth control methods. I had this medication that was kind of like relieving some of the pain. But the thing with the medication that I was using, you can only be on it a certain amount of time. Because if you were on it longer than that certain amount of time, it would start to break down your bones. So it's pretty much a temporary fix. Right. So after that, then it was pretty much time to have the surgery because it got to the point that I just couldn't function. Like I'm just walking, like bending over. I'm at work, trying to make it through the day.
Just going through the motions.
Just going through the motions. And people don't realize how painful endo is.
And certain people, whether it's endometriosis or fibroids, every woman is different, so it may affect you differently.
Yes.
Depending on your, body type and health history, how it affects you can be different. And I do want to say that a lot of people may ask, like, how do you get it? They say there's no reason you can get it. They do say, right, that there may be factors that may contribute to it, like what you eat, stress. Things of that sort, but there's no way, any woman can get it, and African American women get it more commonly than other races.
That's absolutely correct. So there is no rhyme or reason. A lot of there are studies out there that connect it to if you have ever had a relaxer for black women, the numbers are higher, but African American women are 2 to 3 times more likely to get it than any other race. Then you also are at higher risk during your childbearing years until you kind of get to like those 50s. That's when you peak, and that's probably because you're going towards like menopause. yeah, those are pretty much the
Relax. Look, I
factors.
got relaxer since I was about 7. Jeez, that's a long time. Okay, so let's get into the treatment. So, when did you? How long was it before you decided from your diagnosis and your physician to pick a treatment option to get one?
So my new specialist, so my GYN that I sought out myself, she basically was like, the best delivery for you would be to have a hysterectomy. She was like, what are your reservations? And I was like, well, I'm single. I'm not married. That might be a deal breaker for my husband. I don't have any children. You know, I'm just going through the list. And she was like, I understand. She was like, so I'll give you 3 years to get pregnant. And if it doesn't happen, then, you know, then it's going to be time. So I'm like, okay, 3 years. So I'm like, okay, God, do it for me. But during that time, COVID hit. So I was granted another 3 years. So by that time, like, the pain was just unbearable.
So your symptoms increased.
My
Yeah.
symptoms increased. It was just terrible. So at that time, after COVID, I was like, okay, God, it's time.
Wow. Okay, so yeah, I said it took me a couple years before I actually got treatment. Now, let's talk about this prepping for treatment kind of briefly. I think when I decided, it was like at the beginning of the year, and then it was like 4 or 5 months later when it actually happened. God works everything out because everything happens how it was supposed to, because I was going to put it off some more. I probably should have had it the year before, but because I didn't, I feel like that made things a little worse. And the crazy part about that is, so once I told my doctor, like, okay, I want to have the myomectomy. I said, I'm going to have that. And once we agreed upon that, you know, it's all the treatment you got to prepare. Like, you got to go take lab tests. She made me do all this stuff. Now I had to get some other tests with that, some other things they were doing. And then while I was prepping for that, I had a mass in my breast at the same time. So I'm like, okay, you ain't got to show me that I'm strong. Like, I can't deal with both of it. So they had me. So 1 week I'll be going to take lab tests for one. Trying, you know, they had to, you know, do the lab tests and do like a biopsy to make sure I was in good condition to get the myomectomy. But then I had to go take a mammogram and ultrasound and all this. And I'm like, okay, look, so I'm going to have to give, like, I can't deal with both of it. So it was just and we'll talk about the mental health part of that when we talk about our recovery and stuff. But it was a lot. It was like, and I didn't really tell nobody about the mass part till later, because I'm like, that's too much. You know, that's too much. But that ended up being, we'll just watch that. That's nothing for now. I was like, thank you, Jesus, because I can't deal with both. But even with the test prepping for the surgery, like, I've never broken a leg. I've never broken my full fingernail off. None of that. So having surgery like that scared me. Yeah, I believe in God and all of that, and Jesus is the Lord and Savior. However, I was like, I'm not ready for this. So it was a lot. And it was one period, like in a week, they kept having me go back to take these labs. Oh, the labs didn't take. I said, the 10 labs I took didn't take? Can you come back? And you got to wait 2 days and you got to do it over. And then you got to go and take the biopsy of, you know, your uterine, whatever, on the next week. And I'm like, so I was in the doctor's office like 3 times a week for like 3 weeks straight. And I was like, this is crazy. So that was me prepping for, like, mentally kind of prepping to, you know, get and physically to get the myomectomy. And then when it was time for the myomectomy, we'll talk about how, like, everything I did a lot of research, YouTube, university, to prepare me, because nobody I knew, for the most part, I knew Taffy had went through, you know, some things, so I talked to her about, but nobody really knew that I knew around me, for the most part, like what it was or how to prepare anything. So how did you prepare, Taffy, to have your actual surgery? What was that leading up to that?
So like I said earlier, I didn't do any initial research, but once I was diagnosed, I found out that actually for endometriosis, there's an endometriosis organization here in Milwaukee, and it's headquartered here. And then once I found that out, then I started doing a lot of research about endometriosis. I joined a support group, which I was the only African-American woman in the group. but I learned so much. I learned during the time when I was diagnosed, a lot of doctors were not familiar with endo, right? And so a lot of women were getting misdiagnosed. A lot of women were having hysterectomies when they shouldn't have been having them,
I believe that and heard about
right?
that.
A lot of women were told there was something wrong with them mentally, that they need to go see a psychiatrist, right? And a lot of women weren't believed by their doctors, by their family members, by their spouses or their boyfriends. They thought that women were making up the pain, right? And I heard a lot of these stories in the support group, and I got a lot of that feedback for a few of my family members as well. That was really heartbreaking for me. But lucky for me, my doctor had, back there was, the DIS, a DIS of women who actually went through surgery and had endometriosis. So she would hand these DIS out to her patients so they can show them to their family members, so they can take it to work, so people know that we weren't making this up.
Right.
We're not crazy. It's not in our head.
So you had, well, that's good that she gave you that.
Yes.
So that was kind of support. So you had the support group. You kind of did your research then. Did your physician, how did you prep for your actual surgery? Did you have to take lab tests? Did you have to do any other?
Yep, definitely had to take lab tests. And actually, I prepared myself by talking to the other women in the support group. And like I said, I was one of the lucky ones, because there was women who had hysterectomies. And one of the things about endometriosis, it cause you problems with infertility. So hard time you having kids. In a support group, there were women who empty out their bank accounts doing in vitro, trying to have kids.
And they have endo.
Yes. Marriages broke up, because of it. So endo is very devastating, physically, mentally, financially. So yeah.
And I know people that have endo more than I knew people that have fibroids. It's funny now that I had mine. And the reason why we're here today is because, you, a couple other people I know actually posted about their experience. And I'm like, that's brave. And then next thing you know, it's somebody else that I know. And I'm like, where is all this coming from all of a sudden? I even called somebody out the blue just to check on them because I hadn't heard from them for a while. And she was like, well, I actually just had a surgery 2 days ago and I'm on recovery. And I'm like, for what? For fibroids? I'm like, that's crazy all of a sudden. So did we talk about your treatments? I remember.
We didn't talk about how my prepping. That's what you
Yeah.
talk about.
So let's talk about, Candace, your prepping for the actual treatment that you received.
Okay.
Or procedure.
So just like you, I had to do an ultrasound and a biopsy. And when I share this with you guys, you probably are going to be like, what in the world? So my ultrasound was very devastating. So if for the audience, you don't know, they have to take a wand and put it inside to view and try to find the top of your uterus and try to view all of the fibroids. Well, my uterus was as large as if I was 6 months pregnant. So her trying to find the top of my uterus, she took this wand and she shoved it up there, and it was just so painful. And no matter how much I told her it hurted, she kept doing it. And I feel like she just ignored my pain. And I really wanted to donkey kick this lady, but we worked in the same hospital and I didn't want to get fired. But it's just that I feel like you guys, nobody understood the pain and disregarded it, and was oh, it can't be that painful. But it's let me take this one and do what you're doing to me, So that was my experience with my ultrasound. And then I had the biopsy. And again, that was okay. And just like you shared, at the same time, I also found out that I had a lump in my breast. So I'm just okay,
God, you ain't got to show us. We strong.
God,
you ain't got to show us. We
what
believe.
you trying to do to me, Lord? So, back and forth with all of the tests. And, at the time, my favorite doctor, the gynecologist, was basically, saying, listen, ma'am, if you show up to my emergency room and you need a blood transfusion, I'm taking it right then and there. And like that was the deal. Like I could not show up in need of a blood transfusion. And sometimes I almost bled out, but I didn't go to that emergency room. So finally, I decided like, okay, I'm just stop struggling and just go ahead and get it because it's not getting any better. So that was my experience with preparing myself for the surgery.
Wow, that's a lot. Yeah, that's a lot. Well, I will say, so let's talk about surgery, right? So I had a open myomectomy. So that is when there's, I want to say, two types of myomectomies, right? Is it the open and then the laparoscopic? So laparoscopic is when they take a digital machine and they make small incisions in your abdomen to remove it. I had the open myomectomy where they cut you open. Now, I didn't have a C-section myomectomy, which is kind of normal. I had a vertical all the way up to my belly button. She was hoping she didn't have to go higher because she said, if I have to go higher, then I have to call in somebody that they felt was like, could do that, because I had a couple of, I've heard stories where people have so many. I didn't have a whole lot. I had a few, but there was one that was, they say it could be as small as a pea or big as a grapefruit. Mm-hmm. Mine was bigger. Mine was about 17 centimeters, 17 or 19 centimeters. So it was big. So for me, I was like, oh, well, that's why I can't wear crop tops, because I had this in there. I just thought it's because I was eating all this macaroni and cheese and these cookies. So that made me feel a little better. But when she told me she had to cut me all the way open, how they had the C-sections back in the day, and that they hope that they don't have to go past my belly button, I was like, okay, look, let me tell y'all. So that kind of scared me, but it had grew so big that it was above, like all the way almost up to my chest. So when it was time, my doctor switched facilities. So I loved the facility she was at initially, and I was like, this is going to be great because the care here. And then she was like, well, when you have yours, I'm going to be somewhere else. I'm like, great. And the crazy part is where my surgery was where I was born. Now, because I'm an overthinker, I was like, God, this how you going to take me out. You're going to take me out in the same hospital I was born in. This crazy right here. And my surgery was kind of, it was like not too long after, I don't know if you know Jackie O, which is, I think it's comedian DC Young Fly's girlfriend. She had passed away due to surgical complications, they said. So that was on my mind. Now I'm fighting that. I'm trying to believe in Jesus and I have hope, but I'm like, that's scary because I've never broken anything. I've never had any surgery. So we went in, and because I'm me and I'm extra, I brought Fibroids plugins to the hospital because it got to smell good in here. I don't know, y'all. I brought Fibroids plugins to the hospital. I think I brought an extra pillow. I kind of did my research, YouTube University, ordered everything from Amazon that I needed. And I might do a video showing people, what to bring or what to prepare and buy. The undergarments for after your surgery, the wraps, all of that. Now, I'm going to tell a little bit about this and then we're going to go so I can hear y'all. But the crazy part about it is because my doctor was very busy and she delivers a lot of babies, she wanted me to be near her. Again, I was okay because she was showing me so much love. She like nurtured me and I needed that. She put me on the labor and delivery floor. So after I came out, I went in. Before that, I had to get, you get your IV. I had told them I had troubles with the IV, but it went in. Everything was fine. Once I came out and nurses started coming into my room, they were saying, congrats. It's about 3 nurses that came in and said, congratulations on your bundle of joy. And I said, oh, I didn't have a baby. And I just kept thinking, I'm so glad I'm mentally okay. Because if I wasn't, it's about 3 of y'all that came in here. So I guess after I told the third one, they told everybody else. And then when they came in here, they came back in. One of them said, oh, I'm so sorry. So I get my doctor sent me the pictures because I told take pictures. And I sent it. I probably sent it to you. I was high. I'm sorry. So I was just sending it to people. But they took them out and it was big, and they were like, "Oh my God, that one was about as big as a newborn baby." And I was like, "Stop." So it was just a lot. So that's part of mine. I want to hear about your surgical procedure, and if it was simple and everything went calm, that's fine. Just want to hear a bit about that.
Mine was far from simple.
Oh boy.
Um, First of all, I had to make a hard decision that I wasn't going to try to have any more kids because I had already lost a son. And knowing that endo causes infertility issues, I didn't want to take that chance. And this was before I was ever married. So if I was going to meet somebody, I had to tell them I wasn't going to have any more kids. So that was devastating, for me. And then, so mentally, I was not in a good space. I didn't have my mom because my mom had passed, so I didn't have my mom to lean on. I mean, I had sisters, but having a mom, man, that would have made a world of difference, and I didn't have that. So mentally, I was not in a good space, but I had to have that surgery. And then for the surgery, being told by the doctor, this is what's gonna happen. It's gonna be a 2-hour surgery. You're in good hands. So a 2-hour scheduled surgery ended up being a 6-hour scheduled surgery. Because when she went in, the endo was everywhere. And what had happened to me, my uterus and my bladder was stuck together. And she could not get it apart. And so I had in previous years, I had a hernia surgery. So she ended up having to call my hernia doctor in, and both of them together had to take apart my uterus and my bladder to reach all the endo that I had. They did take pictures and showed me like all the endo I had, a lot of it, and it looked like black charcoal. Just looked really just scary and just yeah. I made it through.
Thank God.
Yeah, thank God I made it through. But then the recovery was a lot longer than scheduled because the surgery was a lot longer. But yeah, that was a really scary time for me. But yeah, and then trying to recover from that, physically, mentally,
And emotionally.
and emotionally.
And we'll get into, because I want to.
It was a lot.
Give a couple minutes for the mental health part. Are we good on time? Mm-hmm. Okay. Tell me about your procedure and going through that. How was that?
Okay, so my procedure also did not go as expected, but I mean, I was in the best hands, and by God would have it, I was a surgical nurse at the hospital, so I was able to choose my entire team. And I think that was part of the mental struggle for me too, because although I know, the team and everything, and I know that people go through it every day, I also know that people can lose their lives. So I'm like, like this person is going to put me to sleep. This will be my nurse. You will be my surgical tech. So I went through and I asked all of my colleagues, like, will you be there for me? And they said yes. So I went in. I had the surgery. They gave me a block that because I couldn't get a laparoscopic because my uterus was like, now I'm 9 months pregnant at this point. So that's how large my uterus is. So I had to get a vertical scar. I could not get a C-section. So it went all the way from my vaginal area all the way up past my belly button. So I have a huge scar that I will wear proudly because I'm so happy that God blessed me to get through it. Sorry, y'all, if I start crying.
It's okay. It's your story.
But
tissue.
Okay, so
Got it.
okay, I got it.
And you're here telling the story, which means you made it.
Yes, I made it. So, even though I was able to control all of that, it's still some things that you just cannot control. So the devil, wanted to start playing tricks like, you're not going to make it. You're going to die on that table. And, I just immediately went into prayer warrior status. Like, okay, let me call thank you, all of my prayer warriors. So I had my friends and my family praying for me, but because I know how my siblings and my mother is, like, I didn't tell them the mental battle that I was having because I'm always the strong one. So I felt a need to still be strong, even though I was weak in the moment. So I had my friends stand in for me, and they did. So I was just so blessed, in that manner to have people praying for me. And after I went up to the floor, well, first they thought they were sending me home after I had been cut. They thought that they were going to really send me home, and that just like scared me.
Off of the open?
Off of the open. So even though my
Open
doctor
myoma.
had orders in the computer that I'm to stay for 3 days, the nurses that took care of me afterwards was ready to try to send me home. So they would not medicate me, even though I kept on telling them my pain is a 10.
Wow.
They thought that they were going to just keep feeding me oral medications, and it wasn't working. So, I'm in so much pain, like pain level of 10, like I can't even advocate for myself. So I had my sister there. She's like, she's been saying for the last 5 hours, her pain level is a 10. What are you going to do for her? So long story short, finally they read the chart, found out that I'm staying, gave me the IV medication, transferred me up to the floor, and then I got a bowel obstruction. So my 3 days turned into 5 days.
Wow.
So,
Yeah.
it was a lot.
And I know sometimes because, again, I did my research. I did the YouTube University, and I saw people that had I'll say simple, still surgery nonetheless, but just a less invasive surgery, and they were fine. And but sometimes, like you had, not the best experience. You had not the best experience. That can happen, and it's traumatic. It's emotionally draining. It's heavy. Whether you have support there or not, support of course helps, but it's still mentally, because you're going through that pain. You're explaining it to your friends and family, but they don't know in that moment how much pain you're in. But you're here telling the story, so I appreciate you. I know I had severe pain, like I said, it was crazy, because I had, certain things have to happen before they release you. It was even, and I did a review after. I was so thankful for the nurses and the care team, because they were so nice and patient with me. One of the nurses was like, "You were just in so much pain last night. I didn't know what to do." I asked the other nurse, like, "Can we give her more? Like, can we give her?" Because they gave me some pain meds, but it was because I had to pass gas and things of that sort before they let you go. But then they made me get up and walk, and I had to walk outside, hear the babies crying. And I'm not gonna lie, I'm a strong person, but pray for your strong friends, I was like, that's a lot. And I had to walk my slow walk down that hallway and hear the new babies crying, because I'm right in the middle of labor and delivery. But that was so much easier for my doctor to get to me, because she was like down the hallway. And then the pain, I did have hypertension during, like, high blood pressure during the time. Actually, maybe leading up to the surgery, during the morning of the surgery, and then after. So they were concerned about that. So they were kind of watching me, making sure, that didn't turn into something else. And I was there for about 3-4 days, released. My mom came and got me. Shout out to everybody that came to the hospital, because people came to the hospital to see me. I had a friend, even she was texting me, but I'm like, I'm high on medication. I can't text you back. And so she was inboxing people she knew, like, can somebody tell me if she's okay? My mom wouldn't answer the phone. She's like, I need to know what's wrong with her. But men and women came to the hospital to see me, so I appreciated that. Just to make sure I was okay, crack jokes. So, but I'm so thankful for those nurses because they were, and my doctor, she was more concerned of the scar. I mean, she wanted my well-being, but she was just like, your scar, it's gonna heal. And I was like, I'm not worried about that scar. So let's get into, so we can kind of wrap it up, but let's get into quickly like this post-recovery. Let's get into just talk about your mental health post-recovery. I'll quickly just say I was on convalescence for about 8 weeks. If you know me, you know I don't sit down, so that was hard for me. I felt like that little boy looking out the window watching all the kids playing outside and couldn't go outside. I had minor complication. As I was healing, I thought I was okay, and I bent over, and it was like, "What are you doing?" So it kind of split my scar. But for the most part, mentally, I just did a lot of praying, a lot of sitting and praying. So tell me, Taffy, briefly about your post recovery, and then just tell us with that about how did your other diagnosis come about, like the fibroids.
For me mentally, I'm not gonna lie that Taffy lost faith. I was angry, right? I was asking God, like, why is this happening to me? I lost my mom, I lost my son, and me having my son had damaged my abdominal walls, so that's why I'd end up having a couple of hernia surgeries. And then the endo. So I was angry. I was angry at God. Like, why is this happening to me? So, yeah, it took, my family to, get me back in a good space. As far as my fibroids, I was diagnosed. That was been in the last like 5-6 years. Same thing, abdominal pain. Started to get heavy periods again. So I ended up having to have, I did an ultrasound, and then I had to do an MRI. The MRI, after having that done, the tech comes out. He said, I lost count how many fibroids you had. You had so many.
Wow. So you went from the endo to having this extensive fibroid diagnosis.
Yes.
Did you get surgery for the fibroids?
I had the surgery.
So you had another surgery.
Had another surgery. Was told surgery on Thursday. I'll be back to work on Tuesday. That didn't happen. That did not happen. I was in the worst pain. I ended up getting so constipated. It was terrible. I was on the floor bawling.
How many years apart was the fibroids?
About 20.
Okay.
20, yeah.
So you were okay after your endo?
I was okay after the
just
endo.
Just mentally getting through it.
Yes.
And then,
never had any more problems with the endo.
Okay.
But then the fibroids.
Jesus. Whew. Okay, Candace. Tell us, how was your mental during the recovery?
My mental during the recovery, like, you still struggle because you're like, I really never gonna have kids, and it's so crazy because I didn't even want kids, but because they told me I could not have kids, like then you just really thinking like, I really don't have a legacy, like what is gonna happen? So sometimes it's still a struggle, but for the most part, I just be like, you know what, I got 20 something nieces and nephews, like I'm gonna just have to leave my legacy through them.
And God will bring legacy, make you make history in other ways, Lord.
I think that's another thing that makes it hard when people, say to you, like, why you don't have any kids? You would be a good mother. And then you have to explain,
Right.
why. And I say the same thing, like Candace, I have a lot of nieces and nephews that I love on. But it's still a struggle.
It definitely is. And just to be clear, just because, with endometriosis and she had, you had a hysterectomy.
No.
So just with endometriosis and with the surgeries doesn't necessarily mean you can't. When myomectomies doesn't necessarily mean you can't have kids. For some, again, it could be difficult, but once you get the surgery, it could be, you could be fine. It just depends on the woman and her history. Let's talk about quickly before we have to end. Let's talk about where we are at now. Now, I will say my surgery was about a year ago. A couple months ago, I had some symptoms, but I was like, that's not that, But just because I'm like, nope, I have health insurance, I'm going to use it. Went to the doctor, checked the ultrasound. Now, they left one fibroid in because it was smaller and it was on the back of my uterus. So she didn't want to chance, it was a little bit more risky going to get that. So I left that one in, but it was so small. They said, that's nothing. That was about a year ago. Had my ultrasound a year later, that one has grown. Now, I know fibroids can recur, but I'm like, within a year? I've heard people it be years, but I'm like, that's crazy. Then they found 2 more. Now I have cysts on my ovaries. So it's a lot going on. And when I tell you that alone, make you be like, bruh, talking to God. Like, come on. But I'm keeping my faith. I'm still in good spirits. They're just watching them. All will be well.
We pray all will be well.
Listen,
Yes.
tell me quickly, what's your current, do you have any, are there any issues with you gynecologically
Yeah.
now?
I've had cysts before too, but lucky for me, they hasn't caused any issues. I've had a pap smear this year, small fibroid. Of course, they're gonna keep an eye on it. But right now it's small and it's not causing me any issues right now. So hopefully pray that it does not.
What about you, Candace?
I am currently in perimenopause because them taking my uterus kicked me into premenopause, and it'll take Tabitha Brown to tell y'all exactly how it feels. Lord, I've been hotter than I ever been hot in places that I didn't even know it should be against the law to be hot in.
You are hilarious.
So, you have all of those things, but I'm grateful. It's almost been a year. So I'm just happy to be alive and able to feel the things that I feel. So,
And just walking out the journey. I think the whole purpose to have this conversation was, again, this year alone, I've seen posts from people I know, talked to people that have experienced it. And before I had my diagnosis, I didn't know anybody that had it. Nobody in my family and friends were talking about it. I see a lot of celebrities and physicians. There's, men and women that talk about, Coach Jesse and things of that sort that talk about the fibroids and endometriosis, PCOS, but there was nobody in my circle, my community, my city that I know of that was talking about it. And being that I have this women's brand, I'm like, well, let's highlight something that I know we've been through and are willing to share, and hopefully it helps somebody that hear it and see the video to either get treatment. Again, you don't necessarily have to get surgery just because you have the diagnosis. It just depends on if your symptoms are severe, what your future plans are, but talk to your physician so you guys can make that decision together. So I just want to thank you ladies for sharing. We could have talked hours, but you never know. We might have to come back to the table, take a seat, and talk about things of this sort or other things that are significant to us and people that look like us. So what I would say also is to women that may see or hear this, if you have symptoms and whatever it may be, talk to your physician. Don't wait. Go to the doctor if you have insurance or, care, and just have them rule those things out. If you don't like what they say, do your research, ask for a second opinion. For men that may be dealing with women that have these issues, be sensitive, get a little knowledge so you know what you're up against. You don't have to know the full gamut of the diagnosis, but just so you know how to handle women in your life and your family that are dealing with this, and people in general. Stop asking women why they don't have kids. When are they going to have kids? you see them and, they may have a protruded abdomen and you say, when are you due? You don't know what women are going through. So just be mindful, be considerate of that. And we appreciate it. We thank you in advance for being considerate of that. So again, ladies, I thank you, Taffy and Candace, for sharing with us today. I'm Kisha. Stay fierce.